Of cancer, 1 out of every 8 women will at some point in their lifetime be diagnosed with breast cancer. But the good news is it is no longer a death sentence. Early detection and proper treatments are key. So to talk more about this, our twin doctors, Dr. J and Dr. I, joining us this afternoon. Thanks for coming in. Good to see you guys.
Always a pleasure.
Yes. So that is the good news about breast cancer. You know,
absolutely.
10 years ago even, you get the diagnosis and your first thought went to that next level.
Right.
But that's not the case anymore, and that has changed because of early detection.
Absolutely.
You know, over the last 30 to 40 years, we've seen the mortality rate from breast cancer drop by like 30 to 40%, and it's all because of early detection. And it sounds cliche, but an ounce of prevention is worth a pound of cure.
Absolutely.
So you just consider this. If you get diagnosed with stage 4 breast cancer, you're only 23% likely to survive.
Which is amazing, that number, isn't it?
Now, stage 1, early stage, 99% survival rate. So from 99% to 23%, and it's all about early detection.
Right. Wow. So now we are being able to diagnose it earlier. But one of the questions I have for the two of you is because there have been so many conflicting reports. We have been told, you know, do self-breast exams, and then we've been told self-breast exams don't work. We've been told do mammograms, and we've told, you know, actually X-rays are maybe better than MRIs. So what do you want women to know about this?
This is what I tell all of my patients. First of all, I think that you absolutely should be doing a self-breast exam. You have nothing to lose from doing it, okay? If you don't catch anything, you don't catch anything. But I've had so many patients that have had normal mammograms that actually caught a breast cancer on their breast self-exam. So that's number 1, do those exams. Number 2, every governing body has different recommendations, but I tell all of my patients, assuming there's no family history, get that first mammogram at 40 and then get them yearly. Now, some folks will say you can wait until 45, do them every other year. But I say start at 40, do them every year. That's my personal recommendation.
Start at 40, do them every year. And what if you have a history in your family? Does that make a difference as to when you tell people to start?
Exactly. So they say if you have a first-degree relative who is diagnosed with breast cancer, start getting your mammograms 10 years earlier than the age they were when they were diagnosed. So if they were 40 when they were diagnosed, you should start it.
Interesting. I sometimes feel like, you know, because there's so much conflict, that some doctors I've heard even telling younger women in their 30s to get a mammogram, and I'm thinking, wait a minute.
No, let me tell you, I've actually done that. So it used to be that we would have women get their baseline mammogram at 35, and they'd moved away from that. I still do that, and I've had a few patients diagnosed with breast cancer at 35 because of that mammogram. So again, you know, I always say do it. The concern is it's tougher when they're younger because the breast tissue is denser, and so you may get false positives, and you investigate things that turn out not to be cancer. But it's better that than to miss them.
But you know, and it brings me back to this too. How many times are there false positives versus that you actually have breast cancer? As a woman, I have to tell you, it is so stressful to have these things done. And obviously you want to save lives. And I'm just going to be honest with you, I'm not so convinced that doing it younger is the way to go, because I think there are so many false positives that the trauma that comes with that is pretty bad.
There definitely are, and the thing is, I think you have to first of all look at the patient's history. So if you have no family history at all, you can definitely wait until 40. But I think the benefit to doing it earlier is that yes, it is traumatic, but the benefit to the mammogram is that if you get it year after year after year, I tell people with your first mammogram, they're going to call you back invariably. They use the mammogram, they compare film after film after film to see if there have been any changes. So when you're 35, 40, I tell them, expect a callback. It's going to happen. You know?
Well, and I do. I get mine every year. Can I share you my funny mammogram?
Please.
You know, we're all friends. Nobody's watching, right? So I remember I went to go get one once, and I was a little nervous because I had to come back. And so I go in to see the doctor, and there's my mammogram, and there's a big circle around, right? And I'm thinking, uh-oh, right? And all of a sudden the doctor turned around, and he goes, oh my gosh, you're Sylvia Perez. I have a daughter who wants to be a journalist, and he starts talking to me, and I'm seeing this mammogram flashing behind me. But all was good. I always think about that now. So that's my funny mammogram story. But bottom line, as you're here, kind of final words to let our viewers know at home, what do you want them to know about breast cancer?
Self-breast exam, and look for skin color changes, skin texture changes, asymmetry in the breast or the nipples, and obviously if you feel a lump. Those are the 4 things to look for.
And redness, that's a big one.
If you notice any of those things, let your doctor know.
Okay, I always love when you guys come in. I have to say something. What's going on here? You've got a new look.
I decided to shave this morning. I didn't want to look like him, so I just shaved my hair completely.
I was totally shocked. I can actually tell the two of you apart now.
That's right. Who is he?
Oh, now he's putting me on the air. Okay. Always good to see you guys. Thanks for coming, and we appreciate important information. Coming up.